Hi, Mr. Tom Jones. My name is Kemi Omoloye, the nurse practitioner student. And like I talked, you were explaining earlier your history of present illness. You said that you have pain and swelling in your right knee that has been going on for like a month, which is on and off. You said like this morning it was more swelling and your leg feels more tight, and that's why you're here. You also stated that you've been taking Motrin for pain, but that is helping with some relief, but then it kind of comes back with the pain. You also reported that the pain is more at night and then increased swelling in the morning. You stated that it's a little hard with mobility, kind of impaired your mobility, like kind of hard getting in the stairs. Also, you said sometimes you feel tight and more painful when you were sitting for in a long time. Okay, so for today I'm going to be doing some assessment to see what the problem is actually is. I know that you had said that you deny any history of trauma, you deny any history of injury in the past, you also deny dizziness and lightheadedness. So we did your vitals, your blood pressure, and all of the good stuff is within good limit. That is, your vitals is okay, and also you're diabetic. We check your blood sugar. Your blood sugar is good. That is within normal limit, which is a good thing. Also, because you are on Eliquis, you said you have no lightheadedness, so which is a good thing. So I'm gonna do your assessment right now. Are you able to lie down for me? Okay. So I'm gonna do some assessment on your knee to see what is actually going on. All right, I'm gonna start by doing a bulge test. That's just a sweep to see if there is fluid on the side, which is effusion. So I'm gonna sweep this side, then sweep back. Okay, there is no bulging. If there is bulging, it's going to be a positive test for effusion, which is going to be that this fluid is on this area, but there is no, that is a negative test. The next test I'm going to do is called a Lachman test, and that is to check for your anterior cruciate ligament, like ligament injury. And that I'm going to do this way, just relax your leg. I'm just going to give it some twist, and then it looks firm. There is no more a lot of pain, which is a negative test as well. And I'm also going to do another test for meniscus, which is like the cartilage tear or injury, and that's called the McMurray test. And that I'm going to put your leg to a full, just lift up your leg from to a full flexion. I'm going to externally rotate and vigorous like that, and see if you're able to tolerate. That's good. Externally rotate and varus as well, so that's good. That's also, there is no meniscus or cartilage tear. And the last one I'm gonna do is called a ballotment test. I'm just gonna sweep the area like that and put some pressure on it and do a tap test. And good, is a little of black bouncing right there, which shows that there is fluid in that area. So from the assessment, it's showing that you have bursitis. Bursitis is a combination of fluid-filled part underneath your patella, and that can happen with repetitive motion or frequent motion in that area. So what I'm going to be suggesting that we do is to aspirate the fluid and ingestion of steroid to relieve the pain and also to help with mobilization and the swelling. But then I'm going to give you informed consent to sign, okay? And then I'll have you get up so I'll give you the informed consent and thank you for signing. So I'm going to do the landmark to check where we're going to be doing the injection and the aspiration. Okay, so this is your superior ligament, and this is the inferior right here, and it's gonna be 1 centimeter out and out, so it's gonna be this area. So I'm gonna choose something to Okay. Okay. The same spot. I'm just gonna put a mark right here. Okay. All right. And so I'm just gonna so for the now that we have the landmark for the procedure itself, if we're gonna be aspirating some fluid out of your nail, and then we're gonna be giving you a steroid just to help with mobility and pain, and for some post-procedure things to watch for. Infection, any sign of infection can be swelling, can be drainage, can be redness in the area. When you notice all of that, we want to know. Also, another thing for bleeding, so after the procedure we'll put pressure for like 5 to 8 minutes. If there is any other bleeding, we'll put more pressure. But when you get home, any side of bleeding, you want to put pressure and come back. And you're going to be doing a 7 to 10 days follow-up, so to see. But if there is any symptoms, we want you to come in even before the 7 to 10 days. And after the procedure, make sure to rest for 24 hours, and then 48 hours, within 48 hours you put ice between 4 and 6 just to help with the swelling. There's something they call post-procedure flare-up pain. If you have that, if that happens, just take I'm going to give you ibuprofen. You take that, and that can help with the pain, but it usually lasts for 1 to 2 days. All right, so I'm going to go to doing the procedure right now. I'm going to wash my hand, and then I'm going to put on my gloves. All right, so right here I have my Kenalog 40 milligram per 1 ml. I have my lidocaine. I have my skin right here. I have my Providin. I have my syringes. I have my 20 gauge and 1 inches. I have my hemostat. I have my 2x2s. I have my aqua swabs, and I have my extra needle for aspiration. All right, so my area is all sterile. The first thing I'm gonna do is I'm gonna clean, and I'm gonna clean from inside and out. Okay, and the next thing is I'm gonna use the Providin iodine, also from inside and out. All right, and I'm gonna let it dry. And the next thing is I'm gonna be applying the numbing spray. Okay, and I'll wait for like 3 to 5 minutes for that. And then I'm gonna, while I wait, I have my 1% lidocaine already drawn, and that's 1 ml. And then I'm gonna be ingesting into 40 milligram of Kenalog. And then shake it together, drawing out is about almost like 2.5 right here. And then I'm gonna cap that, and that area is ready. So what I'm gonna be doing right now is I'm gonna be aspirating the fluid, and I said I'm using 20 gauge. Okay, so I'm beveling up on 1 inches, bevel up, straight and out. Okay, and then I'm aspirating. Okay. Alright, so I already aspirated all the fluid out, and right now I'm gonna be taking this out. Okay, I'm gonna be using my clamp for that, my hemostat clamp. And then okay, and then I'm gonna ingest my fluid. Okay, so I'm just ingesting my fluid. Okay, that's good. And then I'll take it out. Alright, and then I'm just gonna make sure to spread it all around. Okay, and like I said, just make sure the area rests for 24 hours. Apply ice. If there is any complication, make sure to come back. Thank you very much.